Hi there! Today I'm going to go into more detail about everything leading up to the surgery. If you didn't see the first video, I will link to the series here. So here I am, 30 days before the surgery, and I decided to switch my surgeon once I got a second opinion. I decided to switch my surgeon because after meeting the second surgeon and hearing about the process of how he does the surgery versus the process of how my first surgeon does the surgery, it was kind of old school, new school, and I just felt more comfortable and confident with the new surgeon as opposed to the older surgeon, and also credential wise and like fellowship wise. I think it's important to make sure that your relationship with your surgeon is the right fit for you. So it wasn't that one surgeon was necessarily better than the other, I just clicked more with one than the other one. So the next thing to do was to schedule a pre-op for 30 days before my surgery and I did that. That basically you get a bunch of blood work done. They kind of just assess your health to make sure you're in a good enough health to go through a very invasive procedure. Surgery is the word. Next, I had to do a pulmonary function test, which is a breathing test, which is at a specialized place. A breathing test that tests your lung capacity and see if your lungs are strong enough to handle this, because you know, your lungs get greatly affected by this surgery. Also, just curiosity, here's a picture of what the machine looked like. That was my pulmonary function test. I just thought it was really interesting. It's like a little vessel that you go into that like compresses and puts intakes and outtakes of air and tests your lungs. It's kind of cool. So because this surgery was during the COVID year, I had to get a COVID test and then be quarantined for 4 to 6 days afterwards before the surgery. So I have dealt with a lot of surgeries in the past, and I have figured out a strategy that for me works and might be helpful for you guys if you choose to go through the surgery. I kind of just, once you accept that it's happening to you, I just mentally put it in a little box and in my brain and just don't look at it for a while, and then look at it after the surgery is done, because then you can't do anything about it. Then it's over and you can't stress about it. So I really just pretended that it wasn't happening the whole time, and that was just a really good way for me to not have the insane amount of anxiety that I did have about it, whether it's the right surgery for me or what's going to happen. There's so many risks. What if it makes things worse? Like a lot of things to mentally prepare for, and once you kind of come to terms, at least sort of, you need to just put it away. Otherwise, I would just be like a cripple with anxiety and keep going. Even up until the night before the surgery, pretending that it wasn't happening, I had to do the specific showering and stage wiping and setting up a vehicle for my ride. I had to do these things, and I still was pretending like it wasn't happening, but then I got to the hospital and it was happening. So that's what I'll talk about in my next video. Be sure to subscribe and like and do all the things that you do on YouTube. All right, see you next time.